From an ageing population facing the onset of chronic disease to a millennial generation seeking preventative and personalised care, the current medical system in the US is being called upon to reform. Catherine Barrett takes us to Seattle, Washington, and to San Diego, California, home to Bastyr University campuses and clinics where they train future health professionals and science-based integrative approaches that treat the whole person.
I think when we're talking about moving to patient-centered care, we're putting patients in the driver's seat. It's reminding them that we are working for them. We are at their service. They are the boss.
For 2 weeks each summer, patients with Parkinson's disease come to Bastyr University's summer school for an integrated, holistic education in how to augment conventional care with natural therapies.
And it's a marriage between the best of conventional medicine, the best of alternative medicine.
During the week here, I do get to interact a fair amount with some naturopathic physicians, but also a fair number of students. And it is interesting to see how the difference in how they approach the disease and management. There, I think, are complementary ways that a physician and in the allopathic tradition and a naturopathic physician could work together well.
Kimball Magoni is both a Parkinson's patient and an instructor at Bastyr University's Parkinson's School, a leading center for the teaching, research, and practice of natural medicine.
Dr. Mishley has done a lot of good research on diet and exercise and lifestyle choice, really being significant with recovery and in terms of slowing progression of the disease, if not reversing different aspects.
A world-class institution in science-based natural medicine, Bastyr University offers more than 20 degree and certificate programs in the natural health arts and sciences. Students receive their clinical training here at Bastyr Center for Natural Health, the largest natural health clinic in the Pacific Northwest, offering as many as 35,000 patient visits each year.
Hello, how are you?
Hey, I'm good, thanks.
People are drawn to Bastyr's teaching clinics for what's known as the triple aim, that patients get healthier, have lower healthcare costs, and report extremely high levels of satisfaction. This notion is at the heart of Dr. Ryan McNally's practice as Chief Medical Officer of Bastyr University's clinic in San Diego, California.
I oftentimes hear patients say things like, I've never had so many options or things that we can use to treat my condition. Usually I go in and I have this problem and then there's one solution to it. And so patients really like options because then they get to play a role in decision making, and I think you have greater buy-in in terms of patient following through with the advice and so forth.
Bastyr's clinics offer a wide spectrum of holistic medical practices and treatments originating from all over the world. But integrative medicine is not an either-or proposition. It simply offers patients more.
Integrative oncology means bringing acupuncture into the clinical setting, bringing nutrition, bringing exercise science, bringing psychotherapy into the setting, physical medicine, all the way from diagnosis with cancer through primary treatment. It's very important for the American public to understand that integrative medicine means both and. The best of what we call standard care, usual care, in oncology, surgery, is a fantastic treatment for cancer still. Chemotherapy, radiation, all those have their place in cancer care.
This means informing patients about their best options to improve overall health outcomes, with treatments and protocols that look beyond the symptoms to address the whole person. The ancient tradition of acupuncture, for example, tackles stubborn gaps in conventional care, such as chemotherapy side effects.
We can actually pre-treat before a patient goes into a round of chemo. We can pre-treat for those side effects that we know they're going to have as a result of chemo, and it helps to lessen those side effects, or it can help to completely negate them in some patients. That's pretty outstanding stuff.
Tank also works with integrated care teams at the Pacific Northwest's leading trauma hospital, Harborview Medical Center, to help patients manage severe pain.
And that patient's pain, almost every time, drops phenomenally. I have myself witnessed patients go from an 8 out of 10 pain down to a 2 out of 10.
As patient demand for holistic medicine continues to rise, Bastyr University is poised to be at the forefront of groundbreaking research, patient care, and the education of tomorrow's leading practitioners of integrative health and medicine. In Seattle, Washington, I'm Catherine Barrett.